But joining us now, Dr. Tom Frieden. He served as CDC director from 2009 to 2017. Dr. Frieden, good afternoon to you. Good to see you as always. How optimistic are you after this? Excuse me, after this J&J data, and when could this vaccine start to be used?
Well, first off, the laboratory data is encouraging, but laboratory data is one thing, human data is another. And until we have actually the results of the clinical trial, which we may get as early as next week, we won't know. There were media reports just yesterday that J&J has had some unexpected manufacturing difficulties, and that could delay rollout of the vaccine. We also aren't sure that a single dose will work, but the data from yesterday was encouraging because it showed that the immune response was strong and even got stronger for up to 2 months after the initial vaccination.
If single dose does work, and given that this doesn't have to be transported at such cold temperatures, could it be game-changing in terms of the pace of getting America vaccinated?
I think, unfortunately, there's nothing that's going to be game-changing. No one thing is going to turn this around. We're going to still have to wear masks. We're going to still have to distance. And vaccination is going to be a many-month process in the United States. In fact, what we may see, what I hope we'll see in a best-case scenario, is success vaccinating nursing home residents and staff and people over the age of 65, such that by late February, sometime in March, you'd begin to see pretty substantial reductions in the death rate, even if cases continue to spread. The big wild card here, though, is a variant like the B.1.1.7 variant from the United Kingdom, which took a bad situation and made it much, much worse. We need to double down on protection protocols because vaccination is not going to magically make this go away.
No, but it is supposed to help, and it's been such a bumpy start, Dr. Frieden, when it comes to vaccinating. I can't speak for all states, but certainly New York and a number of other states are having trouble. Why is it so hard to figure out whether someone's eligible to be vaccinated and where they can do it?
Well, to be frank, we have a national program that hasn't done this well. They handled it like a grocery delivery program. What's the temperature? What's the restocking cadence? Instead of like a vaccination program where you do a detailed plan and figure out every spot that's going to be vaccinating, how many they can do per day, who's going to go where, how do you communicate with the public. It was only a couple of weeks ago that Congress first approved substantial resources for states to begin the planning process. That money hasn't hit the system yet. So we're looking at weeks to potentially a month or two of continued rocky rollout. But we do see some areas of hope. We do see the numbers picking up. We see the vaccine relatively well accepted by large numbers of people, no significant safety signals, large numbers, over 1 million people vaccinated in nursing homes and other long-term care facilities. So we are seeing some progress, but clearly there's a lot of cleanup to do in how this vaccination campaign is being rolled out.
Well, I get the blame on the federal government, but Dr. Frieden, isn't some of it just the fact that we in this country do not have the sort of national universal health system that we see in so many other countries, like the UK, like in Israel, and it's just not cut out for it. We have this for-profit privatization, which is not a judgment, good or bad, but when it comes to something like this, it's not that helpful.
The way I think of it is you've got a problem that's relatively easier to solve and a problem that's relatively harder to solve. The relatively easier one is very poor management of the pandemic response by the federal government. You need an organized, science-based response that communicates consistently and accurately with the public. I think we'll have that in the coming weeks. The harder part is exactly what you say. We do not have a strong primary healthcare system in this country, and really we suffer for it. We suffer avoidable heart attacks, strokes, kidney failure. We suffer avoidable infections and hospitalizations, and we suffer the failure to vaccinate effectively through primary care. But really, this is a great opportunity. Never let a crisis go to waste. We have the chance to change the way healthcare is delivered in this country and make it more patient-focused so that everyone can have a family doctor. Family doctors can be adequately compensated, and they can help get us through this pandemic and more resilient for the next. It's exactly as you say. In countries where there's a systematic way of linking people to their primary care provider or family doctor, They get an appointment, they go in, they get vaccinated. It's not that big a deal. Here we have to do so many workarounds with large mass vaccination programs, hospitals, other places getting vaccinated, community vaccination sites, Walmart, CVS, and other pharmacies doing vaccination programs. We'll get there, but it's going to be a lot harder because we don't have that kind of strong public health or primary health care system.
Shepard Smith here. Thanks for watching CNBC on YouTube.